Welcome to this podcast on personalised healthcare and access to precision medicines for lung cancer patients. We're recording this podcast at the annual members meeting of LuCE Lung Cancer Europe. LuCE is the voice of people living with lung cancer and their families in Europe. It's a network and a platform for patient advocacy and patient organisations, and it provides help for the support and setup of new patient organisations in Europe. Today we're going to be exploring FT3. That stands for From Testing to Targeted Treatments for lung cancer patients around the world and in Europe. I'm delighted to have with me Helena Harnik, who is from the Synergist, which runs the FT3 programme. The Synergist is an incubator of programmes to deal with social issues, including healthcare. Helena is the co-founder of the Synergist and also Chief Programmes Officer. Helena, thank you so much for joining us to talk about this. Can you tell us why it was important to set up FT3 and also what is its name? How does it come about?
Thank you so much for having me, Jacqui. So FT3, the From Testing to Targeted Treatments program, is a global multi-stakeholder collaborative program. We have over 38 members and members from all different kinds of stakeholder backgrounds, patient groups. We work with healthcare providers, oncologists, pathologists, and also companies. And we came together with the shared vision to improve patient outcomes by bringing to life the potential of personalized healthcare and precision medicine. So what is that? Precision medicine is all about ensuring that patients can have the most accurate diagnostic so that we can guide the best kind of care and treatment that is available for them. And that often requires testing. And in the case of cancer and lung cancer, that requires biomarker testing.
So as you say, it's not lung cancer specific, but why do you think that people with lung cancer should know about personalised precision medicine particularly?
So lung cancer is actually one of the condition areas we started in because it was important for us to start where there was evidence. I'm not a healthcare provider, but I did have a look at the ESMO, the European Society of Medical Oncology clinical guidelines on the way over here. And it clearly states that for many lung cancer patients, it can be very beneficial to go through these kinds of targeted testing or biomarker testing to be able to find the kind of treatment pathway that's most appropriate for you. And it's really important for lung cancer patients, therefore, to discuss this kind of thing with a healthcare provider to see when it can be appropriate.
But what are the key challenges for access to this testing? You know, what's the current situation on the ground for lung cancer patients?
So there are a lot of different challenges for patients still, which is why this kind of collaboration, I think, is so important. One of the things that we observe is that actually the challenges can vary quite a lot from country to country, but there are certain kinds of challenges that we see as being patterns. Typically, one of the biggest challenges we hear is from the patient perspective in terms of information. So it's really important for the patient to know about this, that they are able to ask about it to the healthcare provider and also understand it if it comes up. And something that we hear a lot from the stakeholders we work with is having this kind of information at the right time is being really, really critical. The timing of this kind of test, the biomarker test that you're doing is really important. And if the patient doesn't understand why it's important, they may not know the importance of waiting for the test results and then progress on other kinds of treatments like chemotherapy. And understandably, it's a very anxious time. So being anxious to move forward with treatment can be a powerful force. We also hear that patients would like to know more about their treatment options. In the case of precision medicine, this often includes clinical trials. So understanding what is a clinical trial, would it be potentially important for them, and how to get involved in clinical trials is something that we hear about. But it's important to understand it's not just about the patient and supporting patient information, although it is important. One of the other things we hear about is challenges from the healthcare provider. For the healthcare provider, we all know that healthcare providers suffer a lot of limited time, and you can imagine this kind of thing, the scientific evolution of information and new kinds of treatments coming out all the time is a real challenge. So helping them and supporting them so that they can stay on top of this is important.
And what about health systems? Are there challenges within health systems quite apart from healthcare professionals?
Absolutely. So everything I mentioned so far is just assuming that the test and the treatment is reimbursed, it's available in the health system, but indeed that there are a lot of challenges out there. A lot of the work we do is to figure out what is it that we can do to help decision makers, so health system decision makers like regulators and payers and HTA bodies, we can get very technical here, but to help them understand what is precision medicine, what are these kinds of technologies that are emerging, and also align them on the latest best practices in terms of being able to judge, is it right? What about the value? And understanding that these kinds of innovative therapies require perhaps a different kind of valuation methodology than typically has been done in the past, just because the population sizes tend to be a lot smaller.
Okay, so you talked about the need for information for patients. How has FT3 enhanced patient education materials?
So the way that FT3 works is we have a global community of, we call them champions. So these are, again, patient advocates, healthcare providers, and representatives from companies and pharmaceutical companies and diagnostic companies. And we work together to find out what are the commonalities and what are some common challenges faced between different countries, knowing that there is this variation from country to country. And we can typically find patterns, like I just mentioned, the typical kinds of challenges. And when we identify a challenge, then we will work together to figure out what is it that we can do about it. Often what we do is we start by looking at what is already available, and then we look to see what we can do to scale what works. In the case of patient information, this is exactly what we did. We, very practically speaking, we typically have a working group, and we came together and we said, okay, when it comes to educating the information and making sure they can have informed discussions with the healthcare provider, what is it that would be helpful? And so one of the things that came out of this is a question and answer resource builder. So this is one of the things we do is we don't try to create the resource kind of directly to be used with an individual patient, because we know how important it is for that information to be localized and to be made adapted to that disease condition like lung cancer and to the specific challenges in a country. So this is a resource builder where we provide, typical kinds of questions that could be helpful for patients to ask their healthcare provider at different stages of their patient pathway. But it's designed to be adapted, so it's unbranded and it's in a format that, for example, a patient organization can take and choose which are the questions that are most relevant for them, perhaps add other ones and then add their logo and then make that available to their patients. So this is an example of the kind of resource we build to support education. I also wanted to mention that we have other kinds of resources that we have developed to support some of these other challenges I mentioned. So for example, if you're really trying to look at how to make these kinds of innovative testing and therapies available in the health system, which is more about influencing decision makers, we have developed kind of more advocacy tools, let's say, and here it's more about helping these local champions make sense of the context they're in. It's almost like a decision tree. So we work in this kind of health system. This might be the typical challenges in a country, let's say, that has a centralized healthcare system with this level of availability. And then the ambition is to be able to match that local champion with information they can use. It could be an existing resource. We would also like to share with them case studies of how others in similar situations have overcome them. So that is the kind of support that we are providing.
Sounds like a lot of work. How many people do you have organising all of this, and that you're collaborating with, and how long have you actually been doing it? When did it actually start?
So the From Testing to Targeted Treatments program started about 5 years ago, and we were very happy that Lung Cancer Europe has been one of the founding members. As I mentioned before, we have 38 member organizations, but the bigger network of organizations we work with, I think, is now over 100. And we work with champions all over the world, and we're very lucky because they're all really motivated and willing to lend us their expertise and to be really hands-on with this. So we work a lot through working groups, and we convene moments for peer-to-peer support. So that's something that our collaborators really like, is the opportunity for people to come and present case examples of, for example, a campaign they have tried and things that worked and didn't work. And then we will, I believe, be talking a little bit more about our local pilots. And these are a really great opportunity to figure out what works, but also to share the outcomes of these among the champions so that we can build on what is working and not have to start from zero every time.
Absolutely. I'd love to hear more about the actual tangible work that you've been doing in case studies. But, tell me about some real life examples then of how patients have been supported, maybe a bit further afield in Europe.
So indeed, we don't only work in the area of lung cancer. We have recently had the honor of working with a patient advocacy organization in Nigeria. This is an organization called Project Pink Blue, and we work with Runsi Chidibe there. And we had been doing a project in breast cancer. And the project has been to take these educational resources that I mentioned and then adapting them to local context in Nigeria and then really taking them for a test drive. So we took 3 resources. We took this question and answer resource that I mentioned before, and then 2 others. We actually have another one that's focused more on these targeted tests and what they are, and also on the treatments, including clinical trials. And then we adapted them to the local context. So what does that mean? We took them and we made them appropriate to breast cancer and to the typical questions that, together with Runsi and his team, we would imagine a patient would have in the Nigerian context. And then what we did was the test drive part of it. With Runsi, we ran focus group discussions. So this was with 60 different patient groups. And these were in breast cancer support groups that are already existing. And we worked in 2 different regions in Nigeria, in Abuja and Lagos, and basically showed them the resources and asked them questions to say, okay, how would this be helpful? Does this answer the questions you have? And what we learned was that, in fact, targeted testing, these kinds of innovative therapies, none of them had heard about it before, even though some of them are undergoing treatments with this. So it just pointed to, again, the information gaps that often patients are facing. And they confirmed that this kind of thing would be really helpful moving forward, and not even only for the patient, but they also mentioned the caregiver and also even the healthcare provider. To have something, I guess, common that they can look at together was something that they mentioned was important. But there are also areas of improvement. So one of the things that we know is this importance of localizing it. But even in the Nigerian context, this is a country where there are many local languages. And it was mentioned that this was something that would be helpful to really make it as accessible and understandable as possible. So that would be the next step, is to see how we can further improve these resources to take that into consideration.
Well, let's come closer to home, both geographically and also towards lung cancer. Tell me about some lung cancer pilot programs that you've been involved with.
So about 2 years ago, we had the idea among the members that we wanted to make sure that we were not just a global organization developing global resources, but to be able to have a local impact. And so this is where the idea of demonstration pilots or country pilots came about. And we were looking for partners who would have the willingness or real life need also to improve outcomes for patients. And we had the opportunity of being introduced following an expression of interest to 2 groups, one in Spain and one in Hungary. And we'll hear about them, but they're very different contexts. So in Hungary, the opportunity was more to support with the patient information gap. Hungary is a country that actually has access in the sense of it's a centralized healthcare system, and when a lung cancer patient could benefit from these targeted therapies, it's covered. So they should have access. But the challenge was there that many patients were not going through with the testing and therefore not being able to benefit from the treatments that are available for them. Spain was a very different situation. So Spain is a decentralized healthcare system. And one of the challenges that patients face there is that the availability of these kinds of things is varying a lot based on its region. So it's a bit of a lottery. And in some regions, the availability is much better. In some others, it's not. So here it was more about an influence project. So we were trying to gather evidence to be able to show to decision makers why there was so much variation and how it's important to overcome these.
Well, I think that you've published on these 2 projects as well, and that's great to see. And I'm delighted that we're going to be able to hear directly from 2 of those pilot projects. So thank you, Helena. Stay with me because we are going to be talking again later. But I wonder if I could ask Erika and Diego from Hungary and from Spain to join us in the conversation. Thanks very much indeed for joining us today. It's great to have you here to really hear the real experience of what's been going on. So we have Erika Pataki, who's a consultant at the National Koranyi Institute of Pulmonology. You work in tobacco cessation and prevention. and you represent the Hungary Lung Cancer Patients Association, LuCE, and that in English is a combination of breathe, spirit and alive, which is just a lovely name. So welcome to you. And also we have Diego Villalón, who's a patient advocate, a social worker, and co-founder of the Spanish NGO More Than Ideas Foundation. So thank you very much indeed for joining us. I want to start first of all with Diego, and Helena has beautifully set out the difference between you and Hungary and your different challenges. But I wonder if you could talk a little bit about the work that you've been doing with FT3 in Spain. It's a collaboration between your NGO and also the Spanish Association of Lung Cancer Patients, IACAP. How did it all come about and when did it start?
Thanks for having me here, and I think that it was like a long journey. It was like 3 years ago, something like that, that we were informed that a new group was being formed in Spain to work on access to biomarker testing. So in that moment, when we received the invitation, it was for us a priority, because this is a priority for people impacted by lung cancer. And honestly, IACAP was involved. And for us, that was really important because in that moment, many projects were undertaken in Spain, but patients are not always involved. In that moment, I really congratulate that IACAP was involved, and that was one of the reasons why we decided to involve in this project.
Tell me about the disease burden of lung cancer in Spain and the access to targeted treatments. Obviously, Helena has indicated it's poor, but so tell me about why it was important for you to take part for the patients.
Yeah, for us, lung cancer is a health priority in Spain. As I mentioned before, we have a decentralized healthcare system. It's a public health system, so we are supposed to have access to treatments, but what we find is that there are challenges on patient education and also barriers on access to the molecular diagnosis and sometimes to innovative treatments. If you are treated in Madrid or Barcelona or in big hospitals, university hospitals, you will probably don't have any much problem. But well, you can find also some challenges. But if you live in an isolated place and a rural area or a small city, you probably have some challenges. So that was one of the reasons why we need to push forward and we need to work more on access to treatments and diagnosis.
So really, you wanted to create some noise about this and really raise awareness, I'm guessing. So what have you been doing for this project in a practical way?
Believe me, we made a lot of noise. I mean, because for these years we have done a lot of things in the framework of this project. And one of the things that we decided is to stop and think and to explore the landscape, okay? Because we didn't want to duplicate resources. So what we decided is to explore the perspectives and needs reported by people with lung cancer. So the first thing that we did is to conduct a survey to access to their knowledge, to their experiences, to their challenges. And what we found is that there was a significant lack of information and education and knowledge about biomarker testing. More than 20% of patients affirm not to be tested. That's an issue. And also what we find is that there were some delays in the diagnostic process. And one of the main reasons was due to molecular testing, because sometimes it requires time and even several weeks. So for us, it was a great challenge this study revealed main findings, and we organized a press conference with a high level of coverage in media, 60 people in the room, and more than 1,000 people, viewers online, so that was great numbers. And later we organized a webinar for patients to explain more about biomarker testing. We developed 2 awareness campaigns for social media. We include this topic on an annual conference that we, IACAP and Masquerades, organize annually. So we do a lot of things. And another issue is that we decided to collect data from hospitals, from healthcare professionals, from hospitals of 4 different regions. As we mentioned before, decentralized healthcare system. So if you live in the south of Spain, you will have more challenges than if you live in the north or Barcelona or Madrid. So we collect data and we find that, of course, there are inequities on access to treatments. So we organize a roundtable with experts in some of the regions, in one specific region, Andalusia, in the south of Spain, to define clear actions that should be undertaken to reduce disparities. So that was amazing, yeah.
Well, it sounds like you have been very busy, and as a health journalist, getting 60 journalists along to a press conference is very, very successful. So well done to you for that. But I think that an important part of your work has been giving resources, making sure that the resources are localised for Spanish people. Also, you have different languages in Spain. What have you achieved in this area, and why has it been important?
Yeah, for us it's really important to facilitate information and education to people impacted by lung cancer. For example, FT3 have wonderful materials in English that we could translate to Spanish. It's more than the language. We reviewed the content, and later experts from Spain review the content as well to be adapted to the cultural context, but also to the reality of our healthcare system. So it took a long time, but the reality is that now these resources are available, are free, and we try to disseminate, but we are aware that depending on each person, some people prefer to use social media or to listen to podcasts or to read the material. So we use different channels to make the information more accessible for everyone.
Brilliant. And so what's been the feedback from patients? How has it been received?
It's been received because one of the main conclusions of the survey, I didn't mention before, is that more than 90% wanted to know more about biomarker testing. That's a clear message, and that's something that we emphasize every time that we speak with healthcare professionals. You need to talk about this. It's a complex issue, yes, but if you explain this in a patient-friendly manner, people will understand. We are not stupid, so it's only a base to use the proper words. So everyone is really interested about this topic, and that's why we include this issue in almost everything that we do in lung cancer.
That's great. Thank you very much indeed, Diego, for setting out that very clear picture of what you've been doing in Spain. But let me pass on to Erika, onto the Hungarian experience. Tell me about what you've been doing with FT3 in Hungary.
We have a different healthcare system, and we have a different baseline when the time we arrive at the FT3. Because, okay, the focus is the FT3 is the molecular testing and the targeted therapies, but we had a few different kind of screening program, but we have not enough material if we want to involve the patient for the screening program. This is the baseline, and we started this program, the different baseline. This was the main differences, and we have not material the innovative treatment about the innovative treatments, and this was the huge support for the Hungarian patient organization. And some other differences, we have only one lung cancer focused patient organization in our country.
I mean, did you find from talking to patients that many felt or thought that the only access to treatment for them was chemotherapy, and they just weren't aware of the other treatments that they might be able to benefit from?
Yes, is important is the real knowledge will be able to the patient, because this therapy is a different kind of, yes, this is the new windows for the therapeutic way. It is important the patient is know about what does it mean.
So what has been the impact of the work you have done? And just tell us a little bit about the disease burden of lung cancer in Hungary.
And this is the main cancer raised in our country, but probably the worldwide. Hungary is the winner. But it's important we have much enough material and much enough support for the healthcare provider as well, because this material is not only for the patient, is the healthcare provider nice benefit for the daily life.
And so how have the adaptations been received by the patients and by clinicians?
This was the really sensitive and really nice method, because the FT3 is always really nice tailoring each material for the similar way, like the Spanish method, you know, what is the the best practice in the worldwide, and we tailoring the Hungarian daily life and the lay language, and we adopted our materials.
And so how many people have you been able to reach, would you think?
I believe is a much more than 1,000 people what we are at the moment. We find this material, but we are disseminate day by day, and we try a much more improving this project.
That sounds like a great achievement. So thank you, Erika, for telling us more about what's been happening in Hungary. But obviously yours are pilots, right? And it'd be really helpful to know what your learnings have been from what you've done so far. Diego, what do you think? What are your learnings, and what might you do differently in the future?
I mean, first one, I would say that it's really important to plan. Because sometimes we are in a hurry and we want to do things, and there are many projects, similar projects going on in our country. So it's important to explore the landscape and to think what action can be valuable from a patient perspective. So for me, that's the first point, to dedicate time for that. Also, this is supposed to be a multi-stakeholder project with different organizations involved, and that's an amazing thing. We need to listen to other perspectives, but remember that this is a patient-led initiative. So that's the main issue for me. It's really important that patient organizations have the clear focus on make the main decisions to be clear and to say we need this for patients. So that's an important thing. And last, I think it's important to think about resources, to plan and allocate resources on the different actions that you are going to do, because this is an important issue, and sometimes it requires long activities, long projects, and we need resources. So it's important to plan these resources beforehand, and that's clear.
Sure. Thank you, Diego. Erika, what about you? The same question. What have been your learnings? What might you do differently?
Oh, lots as well. This was some really sensitive and really professional methods what we got the support. And I definitely not find some similar. This was the new experience or life. And some other way, you know, is this project is keep the balance if we want supporting not only the patient, the healthcare provider, and this is a much more professional advocate way, and this was the main what we learned this project.
Well, it sounds great though to be involved in such innovation and to be at the forefront of that. Let me come back to Helena. Can you reflect on what you've heard from Erika and Diego? You know, what lessons have you learned as the originator of the FT3 program?
I think we have learned so much, so it's difficult to distill that into short sentences. I think first and foremost, what I would wish to share is that I think to make local impact, it's really important to have these kinds of local collaborations, and they can work. So that's, for me, really important. I think we have also understood how important it is to be really multi-stakeholder. So what I mean is involving all the different voices who can have some kind of influence. When it comes to educational materials, we've learned how beneficial it can be to have healthcare providers at the table, because it was actually surprising how many of these pilots we have done, and we go in with certain kinds of hypotheses of what we think might be the issue, and then after we kind of come out the other end, having discussed it with everyone around the table, we find that actually it's something a little bit different. So indeed, as Erika was mentioning, in Hungary, I think we just kind of assumed that it was a general information gap. But when we had discussed with the healthcare provider, we pinpointed that's really at the very, very beginning. It's actually making sure that the patient is understanding that there are other kinds of treatment options available to them, that there has been medical progress. This was something that was really important, and therefore we were developing information right at that point and really making sure that it was available then. But even in terms of collaborations, so that the healthcare provider is available and knowing and giving it to the patient at the right time is something that was really important. And I think Erika I think it was over 140 different healthcare centers or medical centers that was reached in the end. And we were going to, Erika was presenting in front of medical conferences, like really getting to where these healthcare providers were. So I think that's something that's really important. The other thing is maybe looking at more what's next. I think to Diego's point about resources, what we have learned is that I think to just go country by country, I mean, of course, it's helpful to have these interventions in a local country, but if we really want to show the potential of this kind of thing and maybe attract even more participation in the future, we're trying to shift it to look at like patterns of challenges and identify what these challenges might be. For example, a case we're looking at is when how to influence the creation of a national cancer plan, or how to make sure these kinds of things are introduced in a national cancer plan. So we look for a kind of typical scenario, and then we're looking for ideally several countries that could fit the bill so that we can have almost a sequence of pilots that we could run after another. So this is something that is coming next, and I'd encourage any of the Lung Cancer Europe patients or patient advocates, or indeed any other patient advocate, to think about this and let us know if they're interested in doing something like that.
Fantastic call to action there, Helena. But let me come back to Erika and to Diego. I wondered if you could give advice to any patient organisations who want to get involved with FT3. What are the tips and advice you think they could benefit from? Diego, I'll come to you first.
I would mention that this is a great opportunity to connect with entities, organizations across the world. I mean, we had the opportunity to attend presence and online meetings to know more about what other organizations are doing in this specific topic. That's crucial. It's not about only share best practices. It's about to know what is happening in Nigeria, what is happening in Canada, what is happening in other parts of the world. I mean, it's important for us not to work only locally, but also to know what is happening in the world and share about best practices and know more about what is not working in other parts of the world. So for me, if you are going to involve in this project, let's connect with other organizations, with other people. We were in contact, we were in touch a lot, Hungary and Spain, to know more about what we were doing each other. So I think that that's an important issue, and I would really suggest people to, like in Lung Cancer Europe, to know more about what other organizations are doing. It's a learning, an excellent learning.
Thank you, Diego. Erika, any tips for organizations wanting to?
I agree, Diego, because it's a really nice possibility and really nice opportunity. And yes, the nice occasion, we learn much more. And this project is tailored to each country, healthcare system and patient organization capacity, for example, because it's important. Some patient organizations have able to build up for the innovative therapy, but some parties is limited capacity building and work some other way. But is important. This project is always keep the sensitivity and improving this project. This was some amazing and unique what we met.
Great, okay. And I just want to come back to you, Helena, and you mentioned multi-collaboration with stakeholders of people maybe you may not think about. I mean, can you spell out who they might be, who patient organisations might want to think about working with and talking to enable this kind of localised education resources to happen and make effective?
So if patient organizations are interested in doing something, of course, they can contact the FT3 group and then myself, and we can help speak with them and understand what specific challenges they're facing and kind of co-design a project together with them. And then, yes, indeed, I think what would be important is to have, or one of the key success factors is to have this multi-stakeholder group locally as well. I think the best experiences we have had is where we have not just worked with the patient organization, but they know, key healthcare providers or other kinds of decision makers that they can bring into the fold. So that is something that I would recommend. And we have a number of resources already ready to be used or ready to be piloted. And also have new ones that we are always in the course of developing. So for example, for the educational resources, we have a kind of 2.0 version of the ones I mentioned before called the Care Compass. And actually we're partnering with Lung Cancer Europe in the development of that. And it's a little bit more sophisticated. We would like to develop something that would be almost a patient pathway builder so that anyone could use that and generate a visualization of the patient pathway and to discover different resources at different moments of the pathway. So we are really imagining something that is designed for the healthcare provider to use in discussions with patients. And then beyond that, I think if there are any patient organizations who are interested in doing more around the area of advocacy, that this is something that we're really looking for partners to help figure out, like exactly what can we do to help accompany them in this process. We would like to do more and to be able to have more sensitivity and understanding different kind of country contexts as well. So again, depending on the health system, what kind of interventions might work well and figuring that out. So we'd be really open to hearing from organizations that are interested in exploring this further with us.
Great, thank you. And Erika and Diego, what advice would you have, given all your work with FT3 and with the testing process and the access to treatments, what would your advice be to lung cancer patients who haven't had a test, who might be hearing this podcast? Maybe they're at the early stages of their diagnosis journey, or maybe later, but haven't had it. What would your advice to them be?
Information and education is always a good recommendation, but we should remember that for many people, it's at the start of the journey. They are in the middle of the process, a difficult emotionally moment of their lives. So we cannot force them to be educated about this in this specific moment of their lives. So for me, it's more about our responsibility as advocates to represent their rights in this specific moment of their lives and fight against administrative and financial barriers and to raise awareness among the healthcare professionals about hospitals to say, in that particular time, we need to speed up the process and to offer the best technology, the best diagnostic process, and in that moment, to support and offer all the help that these people need. But it's difficult. I wouldn't say that they need information in that moment if they don't ask for that. We need to be there for them. I mean, is that the main issue, I think?
That's a great answer, Diego. Thank you for that. Erika, do you want to add anything?
Oh, I don't notice perfect answer, but at the moment I realize, if the patient have some other story, if is affected the lung cancer, maybe is the story of the hope, because the innovative therapies will be the new way, the pathway, and is important to know about earlier. Maybe you are affected this part of the treatment, and is important you have a biomarker testing, and maybe you will be affected the treatment as well.
That's great. Thank you very much indeed. Well, we're coming close to the end of our podcast. I just wonder, and very briefly, what are the plans for the future now for you two in terms of FT3? Diego, I think your project has now come to an end, but I think that you're wanting to disseminate the knowledge wider.
Yeah, this is, we are not going to stop of working on this. I mean, even if we have very good access to biomarker testing, we need to be there and inform people and raise awareness, because this will be always in progress, I mean. So we will continue working on this issue. We will continue being in contact with FT3 and also with all the entities that we have known thanks to this initiative. So we are continue working in research, in education materials, in activities, training healthcare professionals, attending conferences. So it's never stop, and we hope to be there for patients, I mean.
Thank you. Erika?
We are disseminate as well this material, and if necessary, we we be building as well. And at the moment, our plan is a little bit different, but maybe this will be same like a FT3 plan. We want a visual pathway, and it's part of the precision medicine as well, and the biomarker testing part as well. And this is the next year project. And yes, we work together because it's definitely not finished yet, I believe it.
Well, your work is not finished, and sadly our podcast is finished. I have to say thank you so much to our wonderful guests, to Helena, to Erika and Diego, for exploring exactly the FT3 programme and how it's really helping lung cancer patients around the world and in Europe. You can find out more information on the LuCE website and also the Synergist website on the FT3 programme for anyone who wants to get involved and to take this forward with their own patient organisations. It's been really, really fascinating, and I've been delighted to be able to highlight these issues, and I wish you all the very best of luck going forward. But from me, Jacqui Thornton, your podcast host, thank you very much for listening, and I hope it's provided food for thought.